Good evening, doctors. Can you hear me? Join the session as soon as possible. We'll be starting within few minutes. So I hope you have liked the yesterday's live neurology session 5. कल एक्चुअली बीच में अगेन नेटवर्क प्रॉब्लम हो गई थी तो बंद हो गया था बट वैसे भी we took it for the 1 hour. So I haven't started it again. So we are continuing with the tomorrow's session, including today's one. So it is live neurology session 6 here. So let us begin with the today's session. Welcome you all. Good evening. So this was the yesterday's question and some answers also we got yesterday, but due to some network issues, we left here. So, and can anyone write the answers for the question? What are the differences between epidural and subdural hemorrhage? एपिड्यूरल एंड सबड्यूरल हेमरेज के बीच में डिफरेंसेस कल 3 कमेंट आए थे लास्ट में बट मिस हो गए सो अगेन द सेम क्वेश्चन विल कंटिन्यू विद दैट ओनली waiting for your answers giving you 2 minutes. Write down your answers for the question on your screen. We'll be discussing in the next slide. No one with the answer? 1 minute more for your answer. What are the differences between epidural and subdural hemorrhage? We were discussing about the intracranial hemorrhages, out of which these two are they are very much important. So they must be differentiated. Okay, Afrin Hussain. Epidural blood connection between dura and skull, very good. Tearing of middle meningeal artery, very good. Subdural blood connection between dura and arachnoid and tearing in bridging ways. Great, great. You mentioned 2 points. Very good, very good. And Priya Sarvaraj, epidural arterial hemorrhage. Okay. So as the name suggests, epidural and subdural. So उस हिसाब से आप differentiate कर सकते हैं. So let us move to the slide. to the features of both the types of hemorrhages are here. So epidural hemorrhage and the subdural hemorrhage, as the name suggests, epidural, there is accumulation of the blood between skull bone and dura. And which blood is this? It is the arterial blood. Arterial blood in the epidural hemorrhage and venous blood in case of subdural hemorrhage, where in the subdural hemorrhage it gets accumulated slowly between the dura and the arachnoid matter. So the epidural one is between the skull bone and the dura, and subdural one is between the dura and arachnoid. Okay. Next point is the rupture of the middle meningeal artery. And Dr. Afreen Hussain said it is the rupture of the middle meningeal artery after trauma to temporal bone. So the cause is trauma to temporal bone. Next one is in case of subdural hemorrhage, there is rupture of superficial bridging veins between cerebral cortex and sinuses, where the causes in the adults are trivial head injury, alcoholism, and epilepsy. And in cases of alcoholism and epilepsy, also cause is actually the head injury only. And in case of causes in children is the birth trauma while delivery, and the second one is the child abuse trauma there too, or any other trauma, any accident or any head injury like that. Okay, so ultimately the trauma is the cause of the hemorrhage, either it is epidural hemorrhage or the subdural hemorrhage. Third point is the brief unconsciousness followed by lucid interval for several hours in case of epidural hematoma or epidural hemorrhage. And in case of subdural hemorrhage, there is altered consciousness and the ipsilateral pupillary irregularity and the contralateral hemiparesis. Okay. Next, when we talk about the epidural hemorrhage, what are the findings on the CT scan of both the types? So, in the epidural hemorrhage, there is always a convex mass and there will be no crossing suture lines. Always remember, in the case of epidural hemorrhage, you will see a convex mass, and in case of subdural hemorrhage, there is concave mass which also crosses suture lines. You can take the screenshot also. Okay, so this was all about subdural and epidural hemorrhage. Moving to the next, what is SAH? SAH is subarachnoid hemorrhage. Subarachnoid. We talked about the epidural and subdural. Now it is subarachnoid hemorrhage, means bleeding into the subarachnoid hemorrhage. Subarachnoid space. This should be space actually. There's a little mistake. Bleeding into subarachnoid space. Next, a question for you. What is the most common cause of SAH? Most common cause of subarachnoid hemorrhage. Very good evening, Dr. Girdhar. Less people today, I think, not interested in studying neurology. This is a part of the practice of medicine coming maximum if we talk after materia medica. So, what is the most common cause of SAH? Anyone? We'll wait for your answer for next 30 seconds. Chandana ji, aneurysm. Okay. Anyone else? SAH cause subarachnoid hemorrhage. Most common cause. I always say most common would be one. There may be many other causes too. Okay. So the most common cause of SAH. Anyone else? Should we move on or giving answers? Priya Selvaraj, hypertension. Okay. Pallavi Joshi, aneurysm. Great, great, good. Barry aneurysm. Priya Selvaraj. What should I consider your answer to be? Hypertension or berry aneurysm? Dr. Vikrant, hypertension. Okay. Chandana ji, ruptured blood vessel. Manjari, aneurysm. Afrin Hussain, head trauma. Okay. Gridhar, aneurysm. So let me come up with the answer now. Trauma is the very right one. Only Afrin Hussain has said aneurysm and hypertension can be the causes too, but I told you, we are asking for the most common cause, that is trauma. Pallavi Joshi, use of blood thinners, bleeding disorder, and bleeding from an AVM. Okay, very good, very good. AVM. Anyone else with the full form of AVM? Pallavi, you will not tell the full form. Let others tell. What is the full form of AVM? What is the full form of AVM? Other than Pallavi, Priya Selvaraj, Dr. Vikrant, Chandana, Manjari, Afreen Hussain, Girdaji, speak up. Sexually use of blood thinners and bleeding disorders, if they are present. So rather than getting SAH, as in the previous session I told you, the bleeding would be from each and every orifice in case of the use of blood thinners. The patient is on warfarin therapy or aspirin, uh, or any bleeding disorders. So very good, Chandana ji and Afrin Hussain, AVM, arteriovenous malformation. So Pallavi, are they right? So moving to the next question, most common cause of spontaneous SAH. There's a difference between the SAH and the spontaneous SAH. So SAH, the most common cause is trauma, but spontaneous बैठे बैठे अचानक से subarachnoid hemorrhage हुआ है. That is called to be the spontaneous SAH. So what is the most common cause of spontaneous SAH? Yes, sir. Okay, thank you, ji. So always differentiate with your question, understand the question what they are asking for. They are asking for most common cause of SAH or of spontaneous SAH. So for SAH it is trauma, and for spontaneous SAH it is dash 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 dash. Accidents, head injury always already gone in the SH, not spontaneous SH. Ritika Sharma, hypertension. Okay. Anyone else? 10 seconds more for your answer. Sir, I think aneurysm. Okay, ruptured aneurysm. So here is your answer. If you think aneurysm, you are very right. That is the rupture of the berry aneurysm. Be more specific. The rupture of the berry aneurysm, which may be caused due to Marfan syndrome, Ehlers-Danlos syndrome, and ADPKD. What is ADPKD? So actually में disease कुछ और थी. मार्फन syndrome हो सकता है, एलर्स डेनलस syndrome हो सकता है, ADPKD हो सकता है, जिसकी वजह से कहीं ना कहीं बेरी एनेरिज्म का रप्चर हुआ, जिसकी वजह से स्पॉन्टेनियस सबएरेक्नॉइड हेमरेज हुआ है, और उसके आपको साइन एंड सिम्टम्स देखने को मिलेंगे. So the question is, what is ADPKD? Polycystic kidney disease. Okay. And what about AD? AD, PKD is the one disease only. Very good, very good. The complete answer given by the Afrin Hussain. Autosomal dominant polycystic kidney disease. Same with the Pallavi Joshi. Very good, Dr. Channa, Afrin Hussain, and Pallavi Joshi. Right. Moving to the next one. So, most common indicative sign of SAH. What is the most common indicative sign of SAH? When you will judge that the patient is having subarachnoid hemorrhage. What is the most common indicative sign of SAH? Headache. Okay. Anyone else? Pinpoint size pupil glitter. Okay. Good. History of headache. Chandana ji, vomiting, headache. Rafin Hussain, headache. Ashok Sini, numbness. So, headache, vomiting. Okay, anyone else? चलिए तो आपको आंसर बता देते हैं. Headache is the very right answer, but there is a type of headache that is called to be the thunderclap headache. It is thunderclap headache. अब thunderclap headache को पेशेंट कैसे डिस्क्राइब करेगा ये जानना अपने लिए ज़्यादा ज़रूरी है, क्योंकि हमारे को तो पेशेंट से सिम्टम लेना है, सिम्टम के बेसिस पे हमारे को डिजीज डायग्नोसिस, मेडिसिन डायग्नोसिस दोनों करने हैं. तो पेशेंट डिस्क्राइब इट एज द वर्स्ट हेडेक इन लाइफ. ऐसा सिर दर्द कभी नहीं हुआ, बहुत ही खतरनाक सिर दर्द है. ठीक है, बहुत डीप हेडेक है, बहुत ज्यादा सिवियर इंटेंस हेडेक है. that is the way the patient will describe you with the symptom. So thunderclap headache is the most common indicative sign of SH. Unconsciousness and ये सब चीजें बहुत बाद में आती है. ओके, वॉमिटिंग बोला है चन्ना जी. वॉमिटिंग इज ऑलवेज सिम्टम ऑफ वेयर देयर इज हाइड्रोसिफिलस, मींस इंट्राक्रेनियल हाइपरटेंशन जो होता है, इंट्राक्रेनियल हाइपरटेंशन का सिम्टम है वॉमिटिंग. एंड वो भी प्रोजेक्टाइल वॉमिटिंग इज द राइट वन. प्रोजेक्टाइल वॉमिटिंग इज द सिम्टम ऑफ ICH, intracranial hypertension, not intracranial hemorrhage. Next, what is the finding in CSF in case of SAH? Findings in CSF in case of SAH. क्या मिलेगा CSF के एग्जामिनेशन में, क्या मिलेगा? कैसे पता पड़ेगा कि पेशेंट को ब्लीडिंग हुई है? नो वन. It's a very very simple question. Very simple question. Priya Selvaraj, protein. Why protein, Dr. Saab? Anyone else? Protein, Dr. Vikrant, same question to you. Why protein? Why protein in case of subarachnoid hemorrhage in CSF? No one else? Afrin Hussain, okay, Chandraji, increased protein. Afrin Hussain, xanthochromia and elevated WBC. See, protein or increased WBC will be seen in case there is any kind of infection. Always remember, proteins or WBC will be seen in case of infection rather than in case of hemorrhage. Okay, so here the right answer is xanthochromic CSF or bloody CSF. It's easy that simply bleeding हुई है subarachnoid hemorrhage हुआ है so subarachnoid स्पेस में CSF होता है तो ब्लड वहां आएगा ब्लड आएगा तो CSF में ब्लड मिलेगा सिंपल so bloody or that is also called xanthochromic CSF. So Afrin Hussain and Pallavi Joshi are right. Next question. Name the scale used for measuring the severity of non-traumatic SAH. We discussed about the non-traumatic, that is the spontaneous one caused due to rupture of berry aneurysm. So what is the scale? What is the name of the scale used for measuring the severity of non-traumatic SAH? And as always, I'm saying to you that if you don't know the answer, just write don't know so that we can move on. Okay, the people who have newly joined our session today, for them is a note below that is send the following details that is name, qualification and city to our WhatsApp number that is 7737815287 to be added to our broadcast list to get the daily doses of clinical knowledge. And I'm very happy to tell you people that there are many who have joined us who are getting benefited. So Pallavi Joshi, Hunt and Hess scale. Don't know sir. Okay. Are you sure that is Hunt and Hess scale? कोई और तो नहीं? Afrin Hussain also Hunt and Hess scale. The scale used for measuring the severity of non-traumatic SAH. So you people are very right. Moving towards the answer that is Hunt and Hess scale. Whoever don't know, please do mention it in your notebooks and do remember. So the next question on your screen is name the grading used for measuring the severity of SAH by size. And by size in in millimeters. So which type of grading is used for measuring the severity of SAH by size? Thank you for the subscriptions of you people and who haven't subscribed our channel yet, do subscribe. You're watching live neurology session 6. So we have so far did 20 live Materia Medica sessions and 4 neurology sessions in past 1 month. And other than this, there are some special sessions too of Sunday sessions and 50 plus other videos on our channel for you people. So no one with the answer. Grading used for measuring the severity of SAH by size. चलिए तो कोई जवाब नहीं दे रहा है तो मैं ही हूँ जिसको जवाब देना पड़ेगा. So note it down. Fisher grading. Fisher grading.